Welcome to Different Like Me Culture with your host, Alyse November, a licensed clinical social worker for more than 21 years, who brings a brand new approach to learning by providing hands-on, interactive, web-based lessons that are easy to use and implement, and focus on some of the most important topics in today's society: bullying, dementia, special needs, relationship issues in 55-plus communities. These 4 topics are the focus of the Different Like Me Culture program. For more information, call 561-270-2280 and begin your pro-action approach towards these major challenges in our community. Call 561-270-2280 today and get started. Now, here's your host, Alyse November.
Hi, and welcome to Different Like Me Culture. I am Alyse November. I just want to let our listeners and viewers know that you could either listen to us on WNN 1470 AM, or you could watch us live and you just Google WNN 1470, or you could also go into the archives to get the info. So let's get started with today's show. We're going to talk a little bit, we're going to bring together the connection between Alzheimer's and education and why it's important to stay up to date on information and knowledge. And so I'm joined here today by 2 wonderful guests from Alzheimer's Community Care, Maggie Garms, who is their Community Outreach Manager, and also Karen Gilbert, who is the Vice President of Education and Quality Assurance. So we're going to get lots of information today, I know, and I know you guys have a wonderful conference coming up that I know we're going to talk about as well. But I'm all about education because I feel like knowledge is power. And if you don't know something, then you just don't know it. But if you know it, you can make an educated choice, no pun intended,
Absolutely.
About what to do about things. And I think it's just so important, not only for professionals, but for lay people, for people who work with people with memory disorders to get some knowledge too. So let's get started. And why don't you start, go ahead.
Well, I have to interrupt really quick
Go
because
ahead.
you just said knowledge is power, and that is the theme for our 2015 education conference.
Cool.
So
Absolutely.
I'm so
Yay.
glad you said that because that's, really what we're promoting this year with our education conference. And knowledge is power,
Yeah.
and that's what this is. It's an educational conference, and it's to help caregivers and anybody that is dealing with Alzheimer's disease or dementia to come and get the resources that you need to have in order to face this.
Well,
this
why don't we
conference.
just say where the conference is now, and then we'll also repeat it towards the end. But
Sure.
since we just started talking about the
Okay.
conference, let's just kind of get that out of the way. But go ahead.
The conference will be held at the Palm Beach County Convention Center on Okeechobee Boulevard on March 12th and 13th. And we'll talk a little bit more later about
Yeah.
some of the speakers
So
and the
people
topics
could
that
go
will
on
be
your
covered.
website to register.
Absolutely.
So
Yep.
the website is
It's www.alzcare.org.
Okay.
They can also call our office, which is the 561-683-2700 number to get more information.
Okay,
as well.
great.
So,
Okay,
yeah.
so let's talk a little bit, I guess, about information that people would be interested or people need to know. And I know you have something called the Alzheimer's Community Care Innovation Model of Care, which is a mouthful to say. So I know you're going to explain exactly what that is because it's confusing me already. So
We have a very, very innovative model of care, which begins with a family nurse consultant, and this is a registered nurse that works with the caregiver and the patient and evaluates what the needs are. What's so unique about this service is that the family does not pay for this nurse. And the family may engage with this nurse over the course of many, many years as the disease progresses. And again, there's no charge for this service. So it's something that any family, beginning this journey through Alzheimer's disease or having questions about it, is perfectly welcome to call and have the services of that nurse to begin evaluating what's going on. So that in itself is very, very innovative. I don't know of another service where you have access to a registered nurse who's very knowledgeable in the subject matter, and yet there's no obligation and no cost. And that means insurance is not billed either. No one is billed for this service.
It's truly amazing. I know you guys work off of grants and funding and different things, and you offer so many amazing services, because I know I refer my patients because, I do the psychotherapy piece, but sometimes I feel like they need to get connected with other agencies, and I know that your nurses are amazing,
And that's exactly
and they
what
just
they do.
troubleshoot things, because
Exactly.
we go in the house too, but they look at it with just a different set of eyes and trying to help
Exactly.
families figure it out. They see the behaviors happening right there in the house, and it's like, okay, I get it. Okay, so this
They
is
can
what you
be-
need to do.
Right.
Stop arguing.
Right.
I know we're going to talk about this too, but I went to one of your level
Level one?
something
Okay.
Level 1 and
training.
2.
We'll
yeah.
talk about
And
that.
who was the nurse? Karen, would it be? No, I don't know. One of your nurses was there.
Okay.
But the biggest thing that I got was, okay, so she held up a pen. And so she probably does this all the time. So she says, "What color is this?" So we would, of course, say blue, because pen is blue. Well, she'd say, "No, it's not." Say, "What color is this?" "Blue." "No, it's not." Okay. And her point being was, why argue? And I use it with my patients all the time, is who cares if they say it's pink? Who cares?
Right.
Why? What's, we have to pick our battles. And that was just one of my biggest aha moments from that training. And I feel like that piece of information that I got, now I could give out to so many people, because when I'm doing my therapy, it just really helps them get it. What does it matter?
Yeah.
Right.
What does it matter if it's blue or pink? What really matters is they take their medications, they're safe, we reduce stress levels, we figure out how to manage behaviors, but it doesn't matter if they remember what they ate yesterday for dinner or where
if
they
it's
went.
Christmas in July, you
Right.
get those
Doesn't
hats out and you
matter.
say Santa's
Right.
coming, right?
Exactly.
Well,
So-
this is very critical to the level 1 and level 2 training that we offer, and that's open to the community as well. And that's available on our website. And we, of course, teach all of our staff, but other health professionals and family caregivers come, and we teach it every single month. We do level 1 the first week of the month, level 2 the second week. And those are very robust 4-hour programs that go into all of the behavioral variables that you're talking about. And how do you handle behaviors, and what's most likely to be effective. And not only effective in calming that patient, but also in decreasing the stress on the caregiver. And that's where, again, our innovative model is so important, because we support the caregiver and the patient. It's a well-quoted, often quoted statistic by the American Medical Association. Caregivers who do not get help, who do not get support in caring for a loved one with Alzheimer's disease, are 64% of them are likely to pass away before the patient. So the burden is significant, it's very real, and it's critical that they get this help. And so we offer that family nurse consultant, we offer support groups, we offer the electronic locator bracelet for those patients who may be wandering, and 60% or more of patients with Alzheimer's will wander at some point in the disease. And wandering can be very, very dangerous. Many are not found alive if they're not found
I
quickly.
know. I just got a chill. I know.
It's
I've
a
heard. I know.
significant problem. And then we also, of course, have our day centers. And our day centers are licensed under the Specialized Alzheimer's Disease Daycare Act. So we have a higher level of standards that we meet, because we are caring for people with Alzheimer's disease. And so the day center is a huge support for caregivers who may still need to work, or caregivers who frankly just need that break during the day, and it's perfectly okay for them to have that.
I
Yeah,
agree.
go to the grocery store.
I agree.
Go to your
so
exercise. Yeah.
so let's address a problem, because this is what I run into with my caregivers. Is the caregivers either put up barriers themselves, so the caregivers will say something like, "Oh, they're not going to go. They're never going to go to something like that," or the person with the memory disorder will refuse to go. What tips, what pieces, and I don't know if we all have answers, but what do you use, or how do you help
We
people?
encourage them to visit. They can come to our day center. They can have their loved one visit for a short time and see if they begin to adjust, and most often they actually do. And some caregivers will have them attend just for a few hours a day, maybe 1 or 2 days a week. And in many cases, it rapidly builds because they're really enjoying it.
Yeah.
And the caregiver also sees that benefit, which is huge.
Yeah, so that's a good tip, is just to come and visit. Because once you get them hooked, sometimes I'm guessing that will perpetuate itself.
Well, one of the things that goes on in the day centers is we have therapeutic activities all day, so they are really actively engaging. They have crafts, they have live music and dancing. They have board games. They have games that require them to get up and actually move about the room. So
Animal therapists too that come in.
physical therapy, patients who need physical or occupational or speech therapy can actually have that during their day at the day center, and they actually do quite well in that environment. So they're really challenged all day. They're challenged cognitively and they're challenged physically. And what that accomplishes is it is likely slowing their decline. The decline of the disease is inevitable, but if we can slow that decline, they can live at home longer. And that is what most families want. They want to keep their loved one in the home with them. And being in the day center and actively engaging really, really has that positive effect.
Because I know when we do our talks about how to kind of push off the disease or the effects of it, we talk, and that's one of the biggest things they say is three you kind of touched on is socialization, which they're getting because they're engaging with other people, physical activity, and also cognitive stimulation. So they're kind of getting all three at the same time. So yes, what we say is, kind of like you want to do a little bit of a balancing act. So as you're losing, you're gaining, you're making new connections and new synapses, new synapse connections in the brain. And then so as you're losing, you're kind of gaining, you're gaining some new connections.
That's right. And the most informed and motivated caregiver can't possibly give 8 hours or 9 hours of that kind of constant activity that we can do in the day center. And caregivers, shouldn't feel badly about that. And that's another thing that we teach caregivers. I'd like to mention also that we provide education for law enforcement in how to communicate and how to effectively work with someone in the community with Alzheimer's disease if they've been wandering or if they've been involved perhaps in what would appear as shoplifting but isn't because the person doesn't realize what they've done.
Right.
And police officers need to know how to approach them and how to speak with them effectively, as do first responders in emergency situations. We also provide education for other multiple types of community groups and also healthcare providers. So our focus is very much that it really takes the entire community to support this effort of keeping families together.
I agree because I think that's so important because we've had situations where we have the caregiver is being sometimes abused, I guess, in such a way by the person with the memory disorder because of behavioral issues that are popping up, verbal issues, lack of cooperation, and sometimes it looks like a domestic violence issue. And so how do you handle it? And it's just a little bit of a conundrum for most, I guess. But I guess, like you're saying, training those first responders, they know when they walk in how to deal with it and how to manage it and what they're looking at.
Yeah, the signs to look for.
Yeah.
We talk about the distinction between mental illness and this disease, and Alzheimer's is not a mental illness. And so it's not always effective to initiate the Baker Act for someone, even if they appear to be a danger to themselves or others, because it's not a mental illness that's causing that. And we need them to understand that as well.
Right. But sometimes, we're going on that subject because I'm thinking of one case that we have actually where the spouse is very abusive to the husband. And, so there are all kinds of situations that people deal with that involve memory disorder, and caregiving for people where, the wife is kind of just still managing at home, actually is still driving, but is verbally abusive and physically abusive to her
When
husband.
working with the family nurse consultant, we can often get to the root cause of that and what's triggering those behaviors and make appropriate referrals. And there are many, many tools available if we really have an understanding of the dynamics.
You're getting a phone call.
Okay.
Because my therapist is really at wit's end with how to manage it. And my therapists are pretty good with managing behaviors and such. But this one just is really, I think it really needs a village. It needs a team. So we're going to call you on this one to see if we
Right,
can
and
get
that's fine. And
some guidance.
one of the things we teach about as well is when changes happen suddenly, when you're thinking, well, she's never behaved like this before, or this just started, those are triggers for a complete medical evaluation. Because the disease doesn't change suddenly. It's a slowly progressive disease. So we encourage caregivers to get that head-to-toe medical evaluation and also an evaluation of all of the medications they take and the over-the-counters they take, the things that you don't need a prescription to buy but could actually be causing some harm and maybe interacting with the medications, the prescriptions that the patient needs. So that always warrants looking at again. And when there's multiple doctors involved, there could be actually duplications of certain medications. So medication issues are very real and can be very severe.
Yeah, I know they can. And also, like you mentioned, in line with the medications is sometimes a UTI, urinary tract infection,
Absolutely.
can exacerbate some type of memory issues or behavioral issues where they just don't even look like the same person. So you always want to get that medical workup first, and you want to rule out anything medical, rule out medication, rule out are they taking medication that they shouldn't be in the middle of the night and waking up because they know where you keep it and they're overdosing on their meds. What's going on? I mean, I'm sure you guys have that situation all the time. We have it a lot too.
Our staff is trained in great detail about looking for the earliest signs of changes. So someone who normally comes in and says good morning and today did not, that's actually a big deal to us. If they love bingo but they're not really engaging today, that's a big deal to us. And we will encourage the caregiver to get that medical exam. And more often than not, we get a call back saying, you were right. And doctor says she's got a urinary tract infection or an early pneumonia, or it's a side effect of a medication that he's now going to discontinue. So those early changes are very, very important, and they can prevent a trip to the ER. They can prevent an inpatient stay. And those are very troublesome for patients with Alzheimer's disease. Any trip to the emergency room, any hospitalization really can further their decline. So we try to prevent that as much as possible by attending to things very early.
I think that's great. And it's just such a benefit of somebody coming to your center and people just being so highly trained in just being aware of that, because I think that the caregivers just go on day after day and they don't really know, okay, they didn't say good morning, thank God they didn't talk to me today because I'm just so overwhelmed, and they're not seeing it as a sign of something's not right here. Right. Not until they're, can't breathe or they're choking or something else is going on, or, are they just figuring out that something's not right.
Yeah, there's always a new set of eyes looking at the patient and that knows them and knows their characteristics and what's normal for them and what's kind of out of the ordinary. And so the warning signs, I think, when you have, more caregivers looking at them and watching them and taking care of them are definitely easier to catch.
So we're talking today with Maggie and Karen from Alzheimer's Community Care, and we're talking about education and why it's so important. And so I think what we're saying is as we said in the beginning, knowledge is power. And sometimes people, I guess, look to avoid, because if I know about it, then I make it real. So what do you think about that concept?
That's very, very true. And we very much believe that knowledge is power, and that if you have all this information, you can make very good decisions, not only about what to do for the patient, but how to safeguard your own health. And there's been a tremendous amount of information in recent years about what you might be able to do on the front end to prevent or delay the onset of these symptoms, life changes that you can make. It used to be people would say, I don't want to know if I'm at risk. I don't want to know if it's in my genes because there's nothing that can be done. But that's not really true anymore. There are changes that people can make that may have that effect of stalling off the symptoms. So if, someone is 70 and the symptoms of memory loss and personality change and so on could be delayed for another 25 or 30 years, that's a really good deal. Mm-hmm. And so, but if you don't know you're at risk, you don't know to make those life changes. And
Right.
that a lot of discussion about that will be going on at this year's conference.
Good.
What you can do, how you can really take control of your future as it relates to the risk for developing Alzheimer's disease. If nothing changes,
If nothing changes
by
in the world.
2050,
Okay.
1 out of 2 people over 85 will have Alzheimer's disease.
That's really scary. Okay, so along those lines, okay, because one of my biggest peeves is why aren't people more proactive in taking care of themselves? And why do we only jump into action when we're diagnosed or we're just imminently worried about a diagnosis? I don't get it. And not that I don't have a cheese doodle here or there, okay, because like we're all real. But for the most part, try to eat as pure and healthy as you can. Try to get some exercise. And try to just take care of yourself, mentally stimulate yourself, socialize, get out.
Right.
And why? Is it just America? I don't know why we only do things when it's like staring us in the face.
We tend to react, and I don't know why that is, and I've been a nurse a long time, and I've seen that in many, many diseases, but it's changed in the last few years. People now see that many cancers have now changed to chronic conditions versus being fatal within a few years of diagnosis. So now they're kind of jumping on that preventive bandwagon. You know, we accept it for mammograms and blood tests, PSA for men for prostate cancer, chest x-rays for lung cancer, colonoscopies to prevent colon cancer. So you are seeing more of that. So I think as the word gets out that there actually may be some preventive treatments, preventive lifestyle changes, and maybe some treatments that one of our speakers will talk about at the conference, I think you'll see more of it. Once the word gets out that, no, it's still not curable, but you can help to prevent it or delay it, then I think we'll see more interest. We're starting to see it now, but it's just the beginning.
And
Yeah.
people start to pay attention really when you say those words.
Yeah, I hope so, because I think it's really, really important, because it's not about making the changes once you're diagnosed,
Right.
which you can make a difference. You know, if you're diagnosed and you start to make some lifestyle changes, just like you were saying earlier, Karen, that we can kind of stall the process.
Right, exactly.
We could keep you good for a longer
long as
period
possible.
of time. But then, like we're saying, take that one step and don't wait.
No,
Don't wait.
because heaven forbid you should wait and have the diagnosis and then it's too late,
Yeah.
you know?
And then it's too late.
Right.
So, because then they even say that you usually have it maybe for years before you even know that you have it. You might see a little sign of this and a little sign of that, but nothing
But
consistent.
people minimize those little signs
Right.
instead of getting an opinion that this may be early signs. And if they did act that early, they might have a different course. Unfortunately, most people are diagnosed in the middle stage.
Yeah.
And at that point, there's been a lot of damage. They can identify changes suggestive of Alzheimer's 10 to 15 years before they actually manifest. That's the time you want to be acting when you're not yet symptomatic. And that's one of the messages we try to get out.
And
Yeah.
usually they say, by the time that you start having warning signs and then you actually go and get a formal diagnosis, it's about 5 years. That's a huge span of time
Yeah.
when you think about it, and all the things that you could be doing in those 5 years to help with.
To help yourself, because it really
Exactly.
does work. The
Right.
studies are done for a reason. And if you are proactive, it works. It definitely works. Maybe not for everybody, but for most. And that's what the studies are showing.
Well,
That
there's-
sleep,
Yes.
get good sleep.
Yes. Don't smoke.
Right, you don't smoke.
Mediterranean diet.
Mediterranean diet.
Very little red
right.
meat.
Cognitive stimulation,
Yes.
socialization,
Yep.
and exercise.
Yep.
So those are the 5 key points. And they say that even if you make a lifestyle change, one lifestyle change, I forget what the number was, but it drastically reduces your chances.
Yes.
Drastically. So make one lifestyle change and it will drastically reduce your risk of getting the disease.
Well, and everything that causes other chronic disease like diabetes and high blood pressure, those are risk factors as well. So to the extent that you take control of those, you're lowering your risk.
Right.
So there's a real incentive.
Right. It's all the same risk factors. So you want to just kind of keep everything under control. So one thing I want to talk about your conference, because I find it really, really unique, different than other, I guess when you think of conference, you think of professional. And the one thing that your conference offers, which I'm hoping I'm speaking, yes, it offers for the layperson as well as for the professional. And you offer it to the caregivers as well as to the professional.
We
and
do.
I know you still have daycare
Oh,
there?
yes, we have respite.
We have respite
Who's
there as well.
offering all these services that I'm not sure that you have it still.
And
but
another thing that we're doing this year is we have scholarship applications for caregivers in order to try to get them there free of charge. And that's a huge thing that we're doing this year to try to help them get there for free and get the resources they need. It's everything Alzheimer's, I say. You know, we have great exhibitors there, long-term care insurance, elder attorneys. I mean, there's so many resources at this conference besides just the speakers that can really help people and help the caregivers and give them the encouragement they need to keep pushing.
That's great. And so I'm just going to say all of the professionals that are listening out there that work with people with Alzheimer's, dementia, memory disorders, whatever it is, make sure that you get this information out there to whoever it is that you're working with, to your to the population that really needs it, because I think that's one thing is just getting the information to the people who
And
will
for
utilize
professionals, they can get continuing education credit for attending the conference.
great.
In virtually every field. They just need to call us if they have a question, but we have numerous boards have approved every program that's being presented.
That's great. And I know you have such a wide variety of topics and information, from medical to social to what?
Long-term care insurance.
How to pick an assisted living facility, what to look for.
Right? Yeah.
Very practical, and people get to choose. We have 24 breakout sessions that they can choose from.
Wow.
And then we have 5 main speakers. And our keynote speaker, I will tell you, is coming to us from the National Institutes of Health. He is the director of the Division of Neuroscience of the National Institute on Aging, and his office controls the research that's being done.
Wow.
So he will be explaining what they've done, what they're doing now, and what they plan to do in the future. That will be an amazing presentation Friday afternoon.
That's exciting. That's really
We have
exciting.
a national speaker on Social Security and Medicare. We have a national speaker on cultural diversity and caregiving. And we have Dr. Watson, a clinical trial investigator from right here in Lake Worth.
Amazing. He's amazing. So let's just tell everybody. First, I'm going to just thank you for coming, but let's get the information out there. So
If you want any information on the conference or on Alzheimer's community care, you can go to www.alzcare.org or call us at 561-683-2700. Again, that number is 561-683-2700.
Thank you so much for being here.
Thank you.
I appreciate it. Given a lot of great information out there. So thank you.
Thank you for tuning into Different Like Me Culture with Alyse November. Join us every Monday at 6 p.m. Call 561-270-2280 for more information. And tune in again next week for more Different Like Me Culture.